Upon completing this in-service, you will number 1, understand precautions to take to avoid exposure to COVID-19. Number 2, understand the difference between standard and isolation precautions. And number 3, know the protocol for following precautions during meal service during COVID-19. The coronavirus disease 2019, COVID-19, pandemic has affected the way we do our jobs in the food service department. According to the CDC, the best way to prevent illness is to avoid being exposed to the virus. We need to protect the elderly because older adults and people of any age who have serious underlying medical conditions may be at higher risk for more severe complications from COVID-19. Take precautions to limit coronavirus exposure. Clean your hands often. The best way to protect ourselves and the patients or residents we serve is to wash our hands often. Wash your hands before, during, and after preparing food, after using the toilet, after blowing your nose, coughing or sneezing, after touching and removing garbage, etc. Wash your hands after any type of contamination. To properly wash your hands, make sure to wet your hands with clean running water, apply soap and lather the back of your hands between your fingers, scrub your hands for at least 20 seconds. Remember, hand sanitizers do not replace proper hand washing. Avoid close contact. The virus is thought to spread person to person between people who are in close contact with each other within about 6 feet. It is also through respiratory droplets when an infected person coughs or sneezes. Stay home if you are sick. Cover coughs and sneezes. Understanding isolation precautions. Standard precautions are the minimum infection prevention practices that should be used in the care of all residents all the time. These practices are designed to both protect the healthcare worker and to prevent the healthcare worker from spreading infections among patients, residents, and includes proper hand hygiene, use of personal protective equipment such as gloves, gowns, and masks, safe handling of potentially contaminated equipment or surfaces in the patient-resident environment, and respiratory hygiene or cough etiquette. Isolation precautions are used to help stop the spread of germs from one person to another. These precautions protect residents, families, visitors, and healthcare workers from the spread of germs. Generally, when someone is placed on isolation precautions, there's a sign at the door to remind visitors and healthcare workers which isolation precautions are needed. All healthcare workers and visitors need to follow these guidelines. Healthcare workers should not eat or drink in isolation rooms and should always clean their hands before entering the room and upon exiting the room. Meal service during COVID-19. Most long-term care facilities were instructed to provide non-communal dining during the COVID-19 pandemic. So when serving food to the residents in their rooms, make sure hand hygiene procedures are followed to prevent cross-contamination. Sanitize any writing materials. When serving food, make sure there is a separate clean cart for food and a separate cart for collecting dirty plates, silverware, cups, and glasses. Always practice good hand hygiene when assisting residents at mealtime. Clean and sanitize properly. For food contact surfaces, make sure to clean first if dirty, rinse, sanitize, and air dry. Clean food contact surfaces after usage before food handlers start working with a different type of food. Anytime food handlers are interrupted during a task and contamination may have occurred, or after 4 hours of continuous use. Make sure to clean and sanitize those high-touch areas such as door handles, light switches, phones, desks, computer mouse, remotes, countertops, etc. a minimum of twice per shift. There are several cleaning products that kill COVID-19. It is best to contact your chemical supplier to find out which products are safe for food contact surfaces. Check the product label prior to use and follow proper instructions for use. Monitor the dish machine. Monitor dish machine temperatures and sanitizer strength frequently. The CDC guidance is to continue to process dishes the same way as always. This is true for a low temperature machine with chemicals or a high temperature machine. There is no need to use disposables to serve the food as they may become in short supply. By adhering to these procedures for proper isolation, sanitation, and personal hygiene, we can keep our residents and staff safe and healthy during this uncertain time. Test your knowledge from this in-service. Question number 1. Take precautions to limit coronavirus exposure by A. Clean your hands often, B. Avoid close contact, C. Stay home if you're sick, or D. All of the above. And the answer to question number 1, take precautions to limit coronavirus by all of the above. Question number 2, which of the following is a protective barrier for standard precautions? A. Mask, B. Gloves, C. Gown, or D. All of the above. And the answer to question number 2, which of the following is a protective barrier for standard precautions? And that would be D. All of the above. Question number 3. Isolation precautions are used to A. Prevent residents from socializing with one another, B. Allow staff to come to work when ill, help stop the spread of germs, or D. None of the above. And the answer to question number 3, isolation precautions are used to, and the answer is C, help stop the spread of germs. Question number 4, true or false? The best way to protect ourselves and the patients, residents we serve during the COVID-19 pandemic is to wash our hands often. And the answer to question number 4 is true. The best way to protect ourselves and the patients, residents we serve during the COVID-19 pandemic is to wash our hands often, and remember to wash your hands for at least 20 seconds. Question number 5, true or false? There are several cleaning products that kill COVID-19. It is best to contact your chemical supplier to find out which products are safe for food contact surfaces. And the answer to question number 5 is true. Make sure to contact your chemical supplier to find out which products that you can use and are safe for food contact surfaces. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served today and every day. If you would like more information about our in-service training programs or consulting dietitian services, please contact us at 1-800-761-9200 or nutritioncaresystems.com.